I'm Tanya Ross of TDR Academy of Movement and Therapy, and today this video is bringing you some information about neurodynamic testing. The test that we're moving on to is for the ulnar nerve in the upper limb tension test series. So these are little active self-tests that you can do. I use slightly different ones in the clinic, but it's making sure that we try to keep it nice and gentle. And again, with these and with this information that you're using, it's not 100% conclusive, but it's going to give you a little bit of information. It's good to have information. But certainly, please watch the other videos at the start of this series, which go through the information behind what the testing is for and how to apply it, because I'm not recovering that again. So with this test for the ulnar nerve, it's almost effectively, it's called Don't Listen. You're going to place your hand up to your ear, so we're into wrist extension, and then we're going to start to pivot that hand to see, can you get the fingers pointing down? Now obviously there can be other things in here, it could be the joints, it could be the muscles that are stopping you, it's not necessarily nervous tissue that's stopping you, but once we're there, I want to make sure that we're getting this sense of whether there's any recreation of nervy symptoms, pins and needles, numbness, burning, tension, certain pains. So whenever we're going through that as a test, you're holding it for, maybe 5-6 seconds or so to see whether anything starts. Always make sure that you do both sides, starting up, rotating the fingers backwards and downwards, and again trying to see, can we get it so that the elbow is pivoting up, and as you hold it, do you get any symptoms? Is it just a stretch, or does it feel like it's something a little bit different to that? So if you find that you're positive on this, that it is giving you nervy symptoms, well then certainly check out our next series of videos, which will take you through some gentle movements, all led by some training that I've done with the Noigroup, which has been endorsed, I feel like, by David Butler. So it's that sense of taking it through these movements to figure out what information it gives you, and maybe as we take it through some gentle movements to effectively slide or glide these nerve tissues, or floss them, so that it might alleviate the symptoms if you retest yourself again on the nerve tensioner. The other test that I sometimes would do would be hands onto the hips and then walking the hands up, see how far that we get, and let the shoulders relax down. It can place quite a big stretch onto the wrist and the thumb area, but sometimes it can be useful. Again, it can give you some information as to whether anything nervy develops in other areas. So I hope this has been useful, if it has, but also if you provide us with a comment, that would be really helpful, and subscribe to the channel because it may give us some more information as to what to give you in future videos. So thank you for watching, and certainly check out our next videos then if you've been positive on that test to see whether it can help.